So let's review the anatomy of the pterygoid region. Okay, tuberosity. You remember? Then we have the incisura behind the tuberosity. Lateral pterygoid lamina, medial pterygoid lamina. Between the laminas we have here the fossa. Inside the fossa we have only muscle, right? Good. So when you do the flap, what do? You start with the knife behind the tuberosity. Then you go mesial. Then you start to raise the flap. So you go from crestal to vestibular, crestal to vestibular, crestal to vestibular. Then from crestal to medial, from crestal to medial. Like I told you, the palatine foramen usually is here. So we feel with the finger where is the foramen because there's a hole, and we raise the flap a little bit more distal and then a little bit more mesial, okay? In order to skeletonize all the tuberosity, right? Good. Then with the elevator, we feel that going lateral, we go up. So we are inside the infratemporal fossa, not our target point. If we are too medial, we go up, and this is not target point. So when we raise the flap, we go with the elevator, and behind the tuberosity, we press, and we feel that there is a resistance. Okay? Good. Then, how do we decide our starting point? Let's imagine that the sinus is like that. Okay? So I tilt the slice, the view on the CBCT, and I go distal, this way. I go distal, and here with the view I see that I have some bone here, I'm inside the sinus, and then some bone cranial. This is the Paga technique, but we want to put it freehand. So we go distal until we are all inside the bone. Okay? Clear? Good. So we measure our starting point, and our starting point is here. Okay? Because the inclination of the implant will be like that. Okay? Then the patient is like that. Okay? I take my pterygoid retractor. I have left side and right side. Is the left side of the patient and right side of the patient. So this is the left side, so I take the part of the retractor with the L, I put it behind the tuberosity, I move lateral medial, because I'm digging inside the soft tissues, and this retractor will be stabilized. Okay? Is it clear? Good. Then I take my implant handpiece. I take my pilot drill. See, I use the ring extension in order to work better outside the mouth. I put my retractor in this way. I decide my starting point, and then I start to drill. and I'm parallel to the retractor, you see? I'm parallel to the retractor, parallel to the retractor. With the pilot drill, I only mark the initial point. I only mark the initial point. Then I take my Terrigo kit. The Terrigo kit is like that. We have 4 bar inside. First bar, 2.0 bar. And the laser mark are 13, 15, 18, 20. Second bar, 2.4 in the tip, 13, 15, 18, 20. Then we have the other 2 bars that they prepare 2.8 diameter millimeter for the coronal part if we use the 3.3 pterygoid implant, and prepares at 3.2 the coronal part if we use the 4.0 implant. So let's take the 2.0 bar. 2.0 bar. I take my pterygoid retractor, I put it in place, I enter inside the point that I did with the pilot drill, and then I drill. How do I drill? I go slowly, slowly, slowly. I feel soft. I'm inside the tuberosity. Then I'm starting feeling hard. Okay, this is the pyramidal process of the palatal bone. So I push, I push, I push until I feel that I'm inside an empty space. I'm inside an empty space. I'm inside the pterygoid fossa. Okay? Good? Sorry.
First mistake.
Then we put the pterygoid retractor and we go. Okay, 2.4 bar, 2.4 bar, 2.4 bar, and I'm inside the pterygoid fossa. Okay? You see where I am following the retractor? I am inside the pterygoid fossa. You see? You see? Perfect. Then we enlarge the most coronal part at 3.2. So I point my bar and I enter, and I enlarge only the first 6 millimeters. Then I take my hand surgical driver, I take my pterygoid implant this way, and I'm start inserting the implant. First of all, look, this is important. Look at my finger, the hand. Okay, good. Don't go directly like that, because we can change the inclination. First of all, use the finger. Use the finger, because the implant is self-tapping. When the implant starts to get taut, you change the inclination. You change the inclination. You change the inclination. If the implant has too taut screw, and screw. Unscrew and screw. Unscrew and screw. Unscrew and screw. Okay? So let's simulate some mistakes, because the mistakes are the best teacher. For example, like I was saying to you before, I feel I'm like that, okay? I'm not from lateral to medial. I am going from medial to lateral. So what do I feel? Soft, and then I fall down. No resistance. It means that this implant will not have torque. Or I'm like that, too vertical. I feel soft, and then I fall down. I am inside the maxillary sinus. Okay? So remember, the inclination is from lateral to medial and from medial to distal. Okay? In order to enter inside the pterygoid fossa. Okay? Is it clear?
Yes.
Okay. Do the zygoma and the pterygoid.